You like to, on the campaign trail, tell some personal anecdotes of people who you've met who've struggled with health care. I'm wondering if you and your family ever did. As a child, was your family ever uninsured? Did you or your mother or your father ever lack for health care because you didn't have the money? Did it ever happen to you?
In a different way, not in the way you're describing, but the health care has been an issue in my family when I was growing up for a long time, for a lot of my growing up years, because my father had a heart condition for a long time, and when he left the mill, he worked in the mill all his life, when he left the mill, it was because of the cost of treating his heart condition, particularly if he needed surgery, was so overwhelming. My mother, who ran a little business, she refinished furniture, had to give, which she loved. She had to give that up and go back to work in the post office.
To get insurance?
To get insurance, so that my parents would have health care coverage. And so I saw it up close in my own family, how it drove the decisions about what my mother and father would do.
And did that impact where you are today?
Oh, of course. I mean, I've lived through, not only that, even what I've gone through with Elizabeth. And keep in mind, we now have everything, and we have great health care coverage. But we would get these, when Elizabeth was getting her chemo, we would get these statements from the insurance companies. And both lawyers, presidential candidate, most people I think would recognize Elizabeth's pretty smart, and you couldn't make heads or tails out of these things. And I just couldn't help but think to myself, most Americans get these statements and they have no idea what to do. I mean, it looked to me like they were covering the same treatment, covering treatment one month and not covering it the next month. And so and your option is to spend years fighting with the insurance companies about this stuff. I mean, that's why I think that both in my childhood and in a very different way, even as an adult who has good health care coverage, I've seen firsthand the problems.
I want to ask you about two more subjects, kind of separate from reform specifically. And the first is Medicare. Baby boomers, here we are, we're coming there. What do you see as the biggest threat to the financial viability of Medicare as baby boomers age?
The biggest threat that is that it runs out of money. I mean, the question is, what do we do about it? I mean, we know that Medicare is financially sick, much sicker than Social Security. We know that the demands on it are high. And unfortunately, we came along and added a prescription drug law that did not address, in a serious way, cost. And the result is many Americans don't get the prescription drugs that they need. We haven't taken on the insurance companies in a serious way to bring down costs. So I think there are a lot of things we need to do about Medicare, and I think it's analytically a mistake to separate Medicare from universal health care because they are completely connected. I mean, the savings in a universal health care system dramatically affect Medicare for multiple reasons. People are better taken care of as they enter the Medicare system, especially if we make some of the changes that I have been proposing. For example, creating a medical home for those with chronic conditions. Chronic conditions account for way over 50% of health care costs in this country. And we don't have a medical home, we don't have a coordinator. People who are getting a multitude of health care don't have anyone to make sure they're getting the right health care or getting it in the right place, all of which should be done. Anybody in Medicare who has a chronic condition ought to have one person who they go to who makes sure that they get to the places they need to go. And prescription drugs, which we spoke about in the forum also. The idea that we didn't use the power of the government to negotiate better prices for prescription drugs is completely unacceptable. And given the cost of prescription drugs, is insane. I mean, we should be using the government to negotiate, a power of the government to negotiate better prices. We ought to do something about drug company advertising. There are some limitations on what we can do, but we should be aggressive about it. And we ought to allow prescription drugs into this country from Canada.
One final question, and that has to do with AIDS. You've announced a program about AIDS, not only domestically but internationally. And the question I would have is this, that there are some reports that have shown that while treatment is getting to more and more people in Africa and elsewhere around the world, that our prevention efforts are lagging.
Yes.
So what kind of emphasis would you place on prevention?
I would put enormous emphasis on prevention, both here and abroad. Would not impose the ideological limitations that we have seen in the Bush administration. I think science-based teaching, education, both here and abroad, age-appropriate sex education. I have proposed in this country, and I know this is somewhat controversial, but I think needle exchange programs can help stop the spread of AIDS, and we should not have a ban on needle exchange programs. And I also think that worldwide, I've spoken about this, but worldwide, instead of using the FDA, instead of requiring FDA approval for drugs that we're using in developing countries, we should use the World Health Organization, which is quicker, makes it easier to get these drugs out, and I think that standard has worked. It's safe. It's more efficient for people who need treatment. So I think all those things. And America's going to have to invest more significantly than we have in fighting AIDS around the world.
You put it at $50 billion?
I did.
Final word. Thank you very much, Senator.
Thank you very much.
Appreciate it.
The Kaiser Family Foundation presents health08.org, election news, analysis, and events.